Have you ever taken your blood pressure first thing in the morning, seen a normal number, and felt completely safe? That feeling is the most dangerous part of this whole story, because a normal number on a monitor does not always mean a healthy artery underneath it. Imagine this. 6 months from now, you check your blood pressure and the number is good. But this time, it is good for a real reason. Your arteries are more flexible. Your kidneys are working with you, not against you. Your sleep is deeper, and the fatigue that used to hit you every afternoon around 3 o'clock is simply gone. Now compare that to where a lot of people are sitting right now, taking Amlodipine or Losartan or Lisinopril every single day exactly as prescribed and still feeling tired, still getting that strange fog in the head by lunchtime, still waking up at 3 o'clock in the morning for no clear reason. Same pill, same dose, completely different outcome. The difference is not the medication. The difference is what you do around the medication. And there is one detail in this video that most people miss completely. A detail involving a woman named Lena, 68 years old, whose blood pressure numbers look perfectly fine on paper, while her body was quietly falling apart underneath. Stay with me until the middle of this video because what happened to her could easily be happening to you right now without a single alarm going off. Before we go further, let me say this clearly because I do not want any confusion. I am not telling you to stop your blood pressure medication. Do not do that. Stopping suddenly can be genuinely dangerous, and it is not something to decide on your own ever. What I am telling you is this: your pill is like a smoke alarm. It is very good at one job. It silences the alarm, but it does nothing about the fire that is still burning somewhere in the house. The fire in this case is a combination of things: stiffening arteries, low-grade inflammation, sodium your kidneys are struggling to release, and stress hormones that quietly push your numbers up behind the scenes. Your tablet can mute all of that on the screen of your monitor. It cannot repair it. And that gap between a quiet alarm and an unaddressed fire is exactly where today's 7 hidden facts live. Let's start with the first one because it explains why so many people on these medications feel drained even when their pressure reading looks perfect. Amlodipine, Losartan, and Lisinopril do not just act on your blood vessels. Over months and years, they can quietly affect your levels of certain nutrients: coenzyme Q10, zinc, potassium, and magnesium. These are not small players. They are involved in how your cells produce energy, how your muscles relax, and how your brain stays sharp. When those levels drift down slowly, you rarely get an obvious signal. Instead, you get vague, easy-to-dismiss symptoms, a tired feeling that sleep does not fix. Occasional muscle cramps, especially at night, a kind of mental fog where you walk into a room and forget why. Most people blame age. Some blame stress. Almost nobody thinks to blame the tablet sitting quietly on their nightstand. So here's the practice step that goes with this fact. Before your next appointment, ask your doctor for a specific panel: magnesium, potassium, fasting insulin, creatinine, and hemoglobin. A1C. Write those 5 words down if you need to. Bring the list with you. This is not about diagnosing yourself. It is about giving your doctor the actual data instead of a vague complaint like, "I'm just tired." Data changes conversations. A vague complaint gets a vague answer. A specific lab result gets a specific plan. Now, let's slow down for a moment because I want this to sink in rather than blur into the next fact. Think about your car for a second. The oil light comes on. You could put a piece of tape over the light so you stop seeing it. The engine keeps running exactly the same either way. The light was never the problem. It was just telling you about one. Nutrient depletion is your body's oil light. Quiet, easy to cover, and completely uninterested in whether you're paying attention. All right, second hidden fact, and this one surprises almost everyone the first time they hear it. For a lot of patients, when you take your blood pressure medication matters almost as much as whether you take it at all. Your blood pressure is not flat throughout the day. It naturally dips while you sleep, and then it surges in the early morning hours, sometimes right around the time you wake up. This is called the morning surge, and it is linked to a higher rate of strokes and heart events, specifically in that early window. For many patients, taking the pill in the evening instead of first thing in the morning provides better coverage exactly when that dangerous surge happens. This is called chronotherapy, and it is one of those small shifts that almost never gets mentioned during a rush 10-minute appointment. Here is the practice step. Do not change your dosing time on your own tonight. Instead, have an honest, specific conversation with your doctor. Ask directly, would evening dosing make sense for my specific situation given my morning readings? Bring your home blood pressure log if you have one. If you check your pressure in the morning and it runs higher than the rest of the day, that single pattern is worth a real conversation, not a guess. And here's something else. While we're on this topic, and I'm genuinely curious about your experience, if you've ever taken your blood pressure right when you woke up and been surprised by the number higher than you expected, write that in the comments. I'd like to know how common that actually is among people watching this. Let's rest here for a second because that was a dense one. Picture the ocean tide. It doesn't rise all at once. It rises and falls on a rhythm every single day, whether you're paying attention or not. Your blood pressure has its own tide. Fighting it with the wrong timing is like rowing against a current instead of with it. Now, the third hidden fact, and this one connects directly to Lena's story, so pay attention here. A normal number on your monitor can quietly put you to sleep mentally. You see 120/80. You feel reassured and you stop asking questions. Meanwhile, the actual causes, stiff arteries, inflammation, sodium retention, can keep progressing in the background, completely unmeasured by that single number. This is exactly what happened to Lena. 68 years old on Losartan for almost 4 years with blood pressure readings her doctor called excellent at every single visit. And yet she was exhausted by 10 o'clock in the morning. She had a dry, nagging cough she assumed was allergies. She got dizzy standing up from the couch more than once, catching herself on the armrest. Her number said everything was fine. Her body was telling a completely different story. Here's the practice step tied to this. Do not let a good number become the end of the conversation. Track how you actually feel. Energy, dizziness, sleep quality, mood alongside your readings. A monitor measures pressure. It does not measure how alive you feel walking up a flight of stairs. Let's breathe for a moment before the next one. Because the fourth fact is one where the stakes go up significantly, especially for anyone over the age of 60. Fourth hidden fact. Dehydration in these medications are a genuinely risky combination, and it's rarely explained clearly. When you don't drink enough water, your blood volume drops. Combine that with a medication that is already working to lower your pressure, and standing up quickly can cause a sharp, sudden drop in blood pressure. This is called orthostatic hypotension. It shows up as dizziness, blurred vision for a few seconds, or that light-aided feeling right after you stand. For a younger person, that might mean a moment of discomfort. For someone older, it can mean a fall. And a fall at 70 or 80 years old is not a small event. It can mean a fractured hip, a hospital stay, and months of recovery. This is precisely why Lena's dizziness was not something to shrug off. It was a warning sign hiding in plain sight, dressed up as just getting older. Here's the first practice step for this fact. Every morning, right after you wake up, drink a full glass of water with a small pinch of natural mineral salt stirred in. Do this before coffee, before checking your phone, before anything else. This rehydrates you after hours without fluids overnight, and it gently supports your sodium and mineral balance heading into the day. The same balance your medication may be quietly depleting. Second practice step, same fact. 20 minutes of brisk walking in the morning. Not a jog, not a treadmill sprint, just a real purposeful walk outside if you can manage it. Movement like this stimulates your blood vessels to produce nitric oxide, which helps your arteries relax and widen naturally. Combined with proper hydration, this is one of the most direct ways to support healthy circulation without adding a single new pill to your routine. Let's slow the pace here for a second and just picture it. Grab a glass, add water, add a small pinch of salt, drink it before anything else happens in your day. Then shoes on, door open, 20 minutes outside. That's it. No equipment, no gym membership, no complicated tracking app required. Fifth hidden fact, and this one is specifically about your kidneys. Lisinopril and Losartan both work partly through their effect on your kidneys. That's actually part of why they're effective. But it also means your kidney function needs to be checked regularly, not just assumed to be fine because you feel okay. Two markers matter here: your creatinine level, which reflects how well your kidneys are filtering, and protein in your urine, which can be an early sign of kidney stress before you'd ever notice a symptom. Here's the uncomfortable truth. Many patients go a full year, sometimes longer, without these specific values being rechecked. Not because anyone is being careless, just because in a busy clinic on a 10-minute visit, it's easy for this to slip through the cracks. The practice step is simple, and it folds right into that lab panel I mentioned earlier. When you ask for magnesium, potassium, fasting insulin, and hemoglobin A1C, add creatine and a urine protein check to that same list. One conversation, one blood draw, 5 to 6 answers instead of one. Let's pause again briefly because we're building towards something important. Think of your kidneys like the filtration system in a swimming pool. You can't see what's happening inside the pipes just by looking at how clear the water looks on the surface. You need to actually check the filter. Skipping that check for a year doesn't mean the filter is fine. It just means nobody looked. Sixth hidden fact, and this is where food and other medications quietly work against your blood pressure treatment. Common over-the-counter pain relievers, ibuprofen and naproxen specifically, can reduce how effectively your blood pressure medication works. They cause your body to retain more sodium and fluid, which pushes back directly against what your prescription is trying to accomplish. Most people take these for a headache or a sore knee without ever connecting it to their blood pressure readings creeping upward that same week. There's a second interaction here that's even more important to understand. Salt substitutes, the ones marketed specifically to people managing their blood pressure, often replace sodium with potassium. That sounds helpful in theory, but if you're taking Losartan or Lisinopril, which already cause your body to retain more potassium, adding a potassium-based salt substitute on top can push your levels dangerously high. This combination has sent people to the emergency room without any clear warning beforehand. It's a genuinely serious interaction, not a minor inconvenience. So, the practice step. Before you reach for a pain reliever regularly or a salt substitute at the grocery store, check with your pharmacist or your doctor first. This one conversation takes about 90 seconds and can prevent a genuinely dangerous outcome. And on the food side, this connects to another practice step. For the next 30 days, do your best to cut back sharply on heavily processed foods. Not because processed food is some kind of forbidden poison, but because it's the single largest hidden source of sodium in most people's daily diet, often 3 or 4 times higher than what a home-cooked meal would contain. Alongside that, once you've had that conversation with your doctor, consider adding at least 2 potassium-rich whole foods into your week. Foods like bananas, leafy greens, or avocado, always with your doctor's approval, giving your specific medication and kidney function. Let's rest for a moment here too. Picture your kitchen counter. On one side, a box of something shelf-stable, packed with sodium you can't taste because it's balanced with sugar. On the other side, a banana, a handful of spinach, and avocado cut in half. Same goal, flavor, and satisfaction. Completely different effect on your arteries. Now, before we move to the 7th fact, let me bring you back to Lena because her story is about to make a lot more sense. Lena's doctor eventually ordered a broader workup after her 3rd visit, complaining of fatigue and dizziness. The same labs we've talked about today, plus one more thing, a sleep study. What they found was that Lena had moderate sleep apnea, repeated pauses in her breathing throughout the night that she was completely unaware of. Each pause caused a brief spike in stress hormones and blood pressure night after night, year after year, all while her daytime readings looked perfectly controlled. On top of that, her lab showed low magnesium and mild dehydration, likely worsened by years on Losartan without anyone specifically tracking those levels. 3 hidden problems. 1, medication that was doing exactly what it was designed to do, and a set of numbers on a home monitor that never told the full story. Once Lena started treating her sleep apnea, adjusted her hydration and mineral intake, and had an honest conversation with her doctor about timing her medication in the evening, her actual symptoms improved dramatically. The fatigue lifted, the dizziness stopped, and several months later, her doctor was able to safely reduce her dosage because the underlying fire had finally been addressed instead of just the alarm. That is what this entire video has been building toward. Not a reason to distrust your medication, a reason to stop treating the number on the screen as the whole picture. Now, quick question for you, and I genuinely like to know the answer. Out of everything we've covered so far, the nutrient depletion, the timing of your dose, the dehydration risk, the kidney monitoring, the food interactions, which one surprised you the most? Drop the number in the comments. I read through these, and I'm curious which fact is the least talked about among the people actually living with this. All right, deep breath, because now we need to talk about something that's going to sound uncomfortable at first. For a meaningful portion of you watching this, especially if you're 75 years old or older, everything I've just described could still leave you worse off if it's applied without one critical piece of nuance. Here's what I mean. There's been a strong push in general medicine toward very tight blood pressure control, getting everyone's systolic number below 120. For a healthy 60-year-old, that target often makes sense. But for someone 75 or older, particularly with some frailty, pushing that number down aggressively can actually cause more harm than good. Numbers that low in an older or frailer body are linked to a higher rate of dizziness, falls, and even measurable cognitive decline over time. In other words, chasing a perfect number without accounting for your age and overall condition can create the exact same falls and confusion we talked about with dehydration, except this time caused by treatment that's simply too aggressive for the individual in front of it. This is the nuance I promised you at the very beginning of this video. There is no single correct number that applies to everyone. What's genuinely healthy for a 78-year-old with some frailty looks different from what's healthy for a 55-year-old who's otherwise in strong shape. This is exactly why the 7th practice step matters more than any single supplement or walking routine. Have an honest, direct conversation with your doctor about what target actually makes sense for you, specifically you, given your age, your other conditions, and how you feel day to day, not a generic number from a general guideline. Ask directly, is 120/80 the right goal for someone my age with my history, or should we be aiming for something slightly different? Ask about your dosing timing in that same conversation. Ask whether a sleep study makes sense given your fatigue or your snoring. Bring up any dizziness, any cramping, any brain fog, no matter how minor it seems. A rushed appointment does not naturally leave room for this conversation. You may need to specifically request more time or write your questions down beforehand so nothing gets lost in a 10-minute visit. Let's bring together everything we've covered today into one clear 7-step protocol, something you can genuinely start this week alongside your medication, not instead of it. Step 1. Each morning right after waking, drink a full glass of water with a small pinch of natural mineral salt. Step 2. Take a brisk 20-minute walk in the morning to support nitric oxide production and healthy circulation. Step 3. Add at least 2 potassium-rich whole foods into your week, always after checking with your doctor given your specific kidney function and medication. Step 4. Spend 5 minutes doing slow diaphragmatic breathing before bed each night to calm your stress response and support healthier numbers overnight. Step 5. For the next 30 days, sharply reduce heavily processed foods since they're the largest hidden source of sodium in a typical diet. Step 6. Request a full lab panel: magnesium, potassium, fasting insulin, creatinine, and hemoglobin. A1C along with a urine protein check for kidney monitoring. Step 7. Have an honest, specific conversation with your doctor about your medication timing, your individual blood pressure target based on your age, any symptoms you've been quietly dismissing, and whether a sleep study makes sense for you. None of these 7 steps replace your prescription. All 7 of them work alongside it, addressing the fire underneath the alarm, instead of just admiring how quiet the alarm has become. Before we close, I want to cover something important because your safety matters more than any protocol. Call emergency services immediately if you experience a severe sudden headache, unlike any you've had before. The same goes for chest pain, a blood pressure reading above 180/120, or sudden numbness, especially on one side of your body. These are not symptoms to monitor at home or wait out. They need immediate medical attention. If any of that ever happens to you or someone you love, do not wait and do not try to manage it with information from a video, including this one. Lena's story had a good ending, and I want that same outcome for you. But her turning point started with one honest, detailed conversation with her doctor, not with stopping her medication and not with guessing on her own. If this video gave you something to bring to your next appointment, that's genuinely the entire purpose of this channel. Clear, honest, medically grounded information you can actually use without the fear-based headlines you'll find everywhere else. If you found this helpful, a like genuinely helps other people in a similar situation find this video too. And if you want more breakdowns like this one, clear, practical, and grounded in what's actually happening in your body, rather than just what's on the label, subscribe because there's a lot more of this coming. Take care of yourself.